Welcome to the presentation, Dental Care and Child Health. Today's talk is designed to enhance your understanding of the importance of childhood dental care and its connection to the well-being of the whole child. You'll walk away with feasible strategies for making cavity prevention and oral care part of your daily routine and the routine that you create for the students you work with. There are 4 points that I want to highlight about this upcoming webinar. Any cavity-causing bacteria is transmissible from person to person. Because the developing baby teeth are not as mineralized as the adult teeth, they have weaker enamel and are therefore more susceptible to cavity-causing bacteria. Working with young kids or mouthy kids who are in the phase of their development where they're seeking a lot of oral stimulation causes them to put a lot of toys in their mouth, perhaps share utensils at snack time or meal time, in order to keep our classrooms as healthy as they need to be for these children. Being very vigilant about cleaning toys, cleaning utensils, cleaning cups will prevent cavity-causing bacteria transmission in your classroom. Point number 2, outward signs of dental trauma may not always be noticeable, but a few key signs to look for. There could be blood around the gum line at the base of the tooth. A tooth could be protruding or out of whack, looking as though it's pushed really forward, pushed backward, pushed from side to side. Or a tooth that was previously wiggly might be impacted further into the gum line. Any of these instances mean that it's possible that further damage was done to the underlying permanent tooth. So notify the parents immediately. Let the parents decide whether or not they should seek immediate dental care, but at least give them the option by letting them know about the accident as soon as possible after it occurs. Third point, check in with families about their pediatric dentist. The presenters give links to local community and low-cost resources that you'll see at the end of the presentation. But don't be intimidated about checking in with parents to make sure that they have a pediatric dental care provider established before the child turns 1. It's not uncommon for clinics to say that they won't accept clients before they turn 3, but that information is outdated. A child needs to have a pediatric dentist established by the time they turn 1, and if a dentist is telling you that they won't accept clients below the age of 3, then find a new dentist. The 4th point that I want to highlight is that it's not just babies who need assistance with teeth brushing. If you notice that an older child, for instance, even an 8 or 9-year-old child, lacks the dexterity to tie their shoes, do handwriting, use scissors efficiently, it's indicative that they also may not have the dexterity to properly brush their teeth. If that's the case, they still also need adult support brushing their teeth for their morning and evening toothbrushing routines. Okay, there's a lot more information in this webinar, and I hope you enjoy it and also find it beneficial. Without further ado, let me introduce your presenters. Your presenters are Kathryn Anderson and Dr. Michele Olson. Katie's a third-year dental student at the University of Minnesota School of Dentistry, working on her Doctorate of Dental Surgery degree. Katie is passionate about identifying and eliminating barriers to dental care and fostering clinical practices that best serve patients with disabilities. Katie is currently a fellow in the Minnesota LEND program, which stands for Leadership Education in Neurodevelopmental Disabilities. She is also president of the university's American Academy of Developmental Medicine and Dentistry chapter, a group committed to providing care to people with neurodevelopmental disorders and intellectual disabilities, as well as educating a future generation of providers. Dr. Michele Olson is a pediatric dentist in Maplewood, Minnesota, and a second-year LEND fellow at the University of Minnesota. Dr. Olson received her doctorate in dental surgery from the University of Minnesota, where she also completed a 2-year residency in pediatric dentistry. She is one of the directors of Special Smiles for Special Olympics and an oral health advocate regarding access to care for those with intellectual and developmental disabilities.
Thank you so much for joining us today. My name is Dr. Michele Olson. As you guys heard, I'm a pediatric dentist in Maplewood, Minnesota. I am also the mother of a daughter with special healthcare needs, which kind of sparked my interest in pediatric dentistry as well as providing services to this population. Today we're going to just start with some of the basics, and that is primary teeth. There are around 20 baby teeth, or what we call primary teeth, which start to develop around the 6th week of fetal life. Some cultures also refer to them as milk teeth. Around 5 to 8 months of age, they'll start to erupt into the mouth. However, there is a large variance on when this will occur. Baby teeth tend to be much smaller in size, and they also have a much thinner outer protective enamel, making them much more susceptible to cavities. The first teeth that will start to come into the mouth are actually the lower front teeth, started by the upper teeth, and they should all be in the mouth by age 3. Baby teeth are extremely important for the developing child. They help with speech, pronunciations. They obviously help with chewing and eating. There's definitely a social component to them. They also are very important for holding space for the underlying permanent teeth that are growing. Without a baby tooth in the back, if it is lost prematurely, there's space loss which can prevent non-eruption of the permanent tooth underneath. Baby teeth are also very important for the growth and development of the upper and lower jaws.
So for permanent teeth, we have 32 total permanent teeth, including 4 third molars, or what some people call wisdom teeth. So not everyone has all 4 third molars. The range of eruption times when these permanent teeth will come into the oral cavity has a lot of variance, but it usually begins with those lower incisors and then the 6-year molars, or the first-year molars, or the first permanent molars, I should say. So these permanent teeth are larger. They do have thicker enamel and deeper grooves and more defined anatomy. So that comes into play with bacteria. This deeper groove and anatomy really allows these teeth to be susceptible to bacteria, and so things like sealants can be considered later in life to help prevent these teeth from getting cavities. Permanent teeth are expected to last a lifetime, so it's really important that we take care of them as soon as they start erupting into our mouths. And just going back, one thing with the larger size, that can lead to tighter spacing between permanent teeth and sometimes crowding. So at that point, flossing becomes even more important, and something that we want to incorporate into our oral hygiene regimen at home.
A cavity occurs when there is a breakdown of the outer enamel, which is the hard structure of the tooth, due to acid production in the mouth. This breakdown will expose the softer and more sensitive area of the tooth, and if left untreated, can spread to the nerve inside the tooth, causing pain, swelling, and infection. Dental cavities are actually 5 times more common than asthma in children, but they're nearly 100% preventable. The bacteria that causes these cavities is actually transmissible by the parent. At birth, every child is free from this bacteria. However, they usually acquire it from a parent or a primary caregiver shortly after birth. The bacteria lives in our mouths and will utilize any fermentable carbohydrates, such as those in sugary snacks and drinks, and produces acid upon the breakdown of these foods. There are 3 components needed to cause cavities. Obviously, our teeth, a fermentable carbohydrate, and time. One of the biggest factors of time is frequency. Many people know that candy can cause cavities. However, a lot of people don't know that crackers, fruit snacks, sports drinks, and even milk and breast milk can cause cavities. Carbohydrates, such as those in crackers, are eventually broken down into sugar substrates by the enzymes in our mouth, making them utilized by the bacteria. Every time we eat or drink something with a fermentable carbohydrate, such as crackers, sports drinks, the pH in our mouth will drop, making it very acidic. Our body takes about 20 minutes to bring that pH back up. However, frequent snacking or sipping of sweetened drinks will keep this pH very low, allowing the breakdown or the dissolving of the enamel around our teeth. Prevention actually starts at birth and includes wiping the child's mouth after each feeding with a washcloth, even before the teeth come into the mouth. Children need help brushing and flossing until they can tie their own shoes. This is a great indicator that they have the dexterity to adequately clean their teeth. Once the teeth come in, it is very important to wipe them as well. You can use a toothbrush or a soft overlay over your finger to help clean those teeth. Fluoride is another key component to prevention, and it works in 3 different ways. It first will inhibit the breakdown of the enamel. It promotes remineralization of the enamel, actually making it stronger, and it can stop the production of bacteria in the mouth, hence eliminating the amount of bacteria. There are many different sources of fluoride in our diet, with the most significant sources coming from toothpaste as well as our tap water. Fluoridated toothpaste can be introduced to a child around the ages of 1 to 2, but you only need a little bit. If a child lacks the ability to adequately spit, you actually want to use the size of about a single piece of rice shown in the upper right-hand corner. Once the child can spit a little better, you can increase that size to about the amount of a pea. Most bottled water that we buy in the store does not contain fluoride, and a reverse osmosis filter will actually eliminate the natural fluoride in our tap water. It is therefore recommended that only charcoal filters be used, such as the ones we have in our refrigerators, or use bottled water that specifically has on the front added fluoride. Bottled water will usually advertise it if it has that. However, it usually does not. If those two things aren't possible for the family, the dentist will look at the risk of the child as well as other sources of fluoride in their diet and determine if a fluoride supplementation is needed. One of the biggest keys to prevention is actually diet. Diet always trumps hygiene. The goal should be eliminating the frequency of snacking, which ultimately reduces the acid attack on our teeth as much as possible. Healthy snacks such as those like cheese, fruits, and nuts are really great snacks. Cheese is actually considered a karyostatic snack. In other words, it actually increases the pH in our mouth, reducing that acid. So anytime you have a child who likes to snack on crackers, I also recommend, if they can, pairing it with a little bit of cheese to help prevent that acid. You really want to avoid sticky foods as much as possible. The retention to the teeth promotes a slower breakdown, hence more acid, and obviously candy. Rinsing with tap water after eating can be a big help for that. That fluoride in the tap water, again, helping to neutralize that acid. And most importantly is try to reduce grazing throughout the day. So keeping snack time down to about 30 minutes. So not only decrease the amount of snacks, but make sure that all those snacks are consumed in a short amount of time. Prevention also starts with the establishment of good habits right from the beginning. Obviously, brushing 2 times a day in the morning and at night are extremely important, but also trying not to put your child to bed with a bottle, especially once the teeth are in. That milk will sit on the teeth and it just constantly attack it overnight. Try and drink juice and milk only at mealtime, and only have water in a sippy cup in between meals. Try not to sweeten milk with sugar or chocolate. I have a lot of parents come to me and say, my child will only drink chocolate milk. My recommendation, if I could go back, don't give them chocolate milk and that won't be a problem. The same with juice. Make sure you establish those limits right away from the beginning, limiting the juice to just 1 time a day. A dental home is similar to the medical home, and it's the establishment of care that creates a relationship between the child, the family, and the dentist. We want to see a child have the child see a dentist, at least by age 1 or by the time their first tooth erupts. In addition to checking for cavities, we also closely monitor growth and development. It is imperative that growth is monitored to help prevent unfavorable dental as well as facial development. Early intervention can have extreme benefits, including the reduction of treatment time and decreased symptoms in a child. There needs to be consistent monitoring and development, as well as a comprehensive treatment plan that is best accomplished when the child sees the same provider. The dentist will also provide fluoride varnishes. This is a fluoride application that helps strengthen the teeth. It stays on much better than our normal toothpaste. That can be done at the dentist and sometimes the pediatrician. It's good to let the dentist know if the pediatrician has applied it. A dental home is also a place for trauma resources. When children start to walk, especially around the age of 2 to 3, they are very susceptible to trauma and falls, and having that established home will give you a resource for helping you through those times.
So this is a picture of a primary tooth and its relationship to a permanent tooth. So if you can see the tooth that is down further and it is in front of the tooth that's still within the bone, that lower tooth is a primary tooth or a baby tooth. And you can see the permanent tooth, when it's developing in its little tooth bud, is very close to that primary tooth. So that proximity and that location of the permanent tooth relative to the primary tooth increases the possibility of damage to the developing permanent tooth if the primary tooth is injured. So when we're looking at the development and incidences of trauma, we really want to look both at the primary tooth and the permanent tooth to make sure it's still developing and there has not been an injury to that tooth bud where that permanent tooth is developing inside the bone.
Another thing to note is also the root of the tooth next to the permanent tooth. If a child has a cavity that is not treated, it will eventually lead to infection inside that tooth, and that infection can displace as well as discolor the permanent tooth underneath. So not only is there trauma concerns, but untreated cavities can affect those developing teeth.
So in the event of trauma, it is very important that you find the tooth that has been displaced from the child's mouth. If it's a primary tooth that is displaced, we're not too concerned because there is a permanent tooth that is developing underneath it. But it is important to find the tooth because we want to make sure the tooth has not been swallowed by the child or aspirated, meaning it has been breathed in by the child and into the lung. If the trauma displaces a permanent tooth, there is a possibility that that tooth can be reimplanted back into the socket. So some things to consider is that you want to save the tooth if it is a permanent tooth. You can just be safe and save any tooth that is displaced from a mouth. You want to store the tooth in milk, not water, and that has to do with the solubility of the water that can harm the supportive cells to the tooth. And you want to store it in milk as soon as possible. It's also pertinent information to record the length of time the tooth was out of the child's mouth. That is something, that piece of information is important for your dentist. And then lastly, you do want to call your dentist. It's really important to follow up, to get a game plan going, to make sure that there's no signs of infection or swelling, and just make sure that that follow-up care is received.
Here are a list of resources. These give you additional information regarding diet, snacks, hygiene, and stuff like that for yourself as well as for parents. The Minnesota Dental Association also has a link on there that have a list of community clinics as well as different private clinics that accept medical assistance or some type of managed health care insurance. So that is a great resource for your patients. The American Dental Association also has different links on there with information. Another great thing that can be beneficial is if the child has any type of anxiety or fear with the dental visit, whether they have any neurodevelopmental disability or not. There is a app by Fraser as well as Delta Dental that's called My Healthy Smile app. What it does is it kind of walks through the dental visit and you can customize it to the appropriateness of the patient's age or abilities. Another resource is the Dental Guide by the Autism Speaks organization. You can go ahead and Google that. That gives you more of a social story to help prepare your child for the visit. This is a link to my private practice. I am available anytime with any other questions or concerns. I would love to be a resource for anyone who needs it. Please feel free to contact me.
Katie and Dr. Olson, thank you so much for being here today and giving such great information about how child care providers and parents can easily incorporate oral care into their daily routines to help their students or their families get the healthiest possible start in life. And viewers, if you would like to receive a certificate of 1 contact hour for viewing this information on dental care and child health, please take a moment to fill out a brief survey that's linked below. Thanks for watching.